Hey everyone, my name is Abhijit. I'm a certified life coach and a mental fitness enabler. Welcome to my channel. We're going to be delving into the topic of the differences between a therapist, a psychiatrist, and a life coach. And I think this is a very important topic, and I hope that this actually furthers your understanding and awareness of mental health. I think there has been a lot of talk about mental health the last 10 years and even more. And I'm really glad if you're tuning into this channel to further your mental health education. I think going from mental health awareness to mental health education is also absolutely integral. And I'm glad that the awareness has brought you to this channel and you're wanting to explore more. So let's dive in, basically. A therapist is, or also goes by, the labels of a counselor or the titles of a counselor, a psychotherapist. What a therapist does is they sit with you and they work with you on your emotional or psychological problems. Could be relationship issues, could be that you're just feeling low and you can't explain why, could be that you're having anxiety issues, you're having a lot of panic, stress, and you don't know what to do with it, you don't know where it's coming from, you don't know how to deal with it. Maybe you have a lot of emotional struggles, you're angry all the time, you're going through a lot of guilt, shame, you're grieving, essentially you've lost someone, right? So in those cases, a therapist is someone who can actually work with you to help you better understand the root cause of these problems and what you can do about it. In many cases, they also, of course, advise on how you can manage some of the symptoms that you may be going through, help you sort out your emotional and psychological problems. They aid you with that. A psychiatrist, on the other hand, is a medical doctor. So a therapist isn't a medical doctor. So what I mean by medical doctor here is someone who can prescribe medication. And I think that distinction is absolutely important to remember as well. A psychiatrist is someone who can actually prescribe medication for a certain illness you may be going through. So for example, if you're going through depression, or you're going through anxiety, or you're going through PTSD, post-traumatic stress disorder, there's medication that you'd have to take for it, and a psychiatrist is the right person to go to for that. A lot of times people, at least the ones that I have come across, mix, they call a therapist and a psychiatrist anonymously, but it's very important that you remember the distinction between what a therapist does and what a psychiatrist does. And many a times a psychiatrist can also, be a therapist. But that's, of course, something that you'll find a lot of people, a lot of clinicians in that sense, who practice both. But in essence, it's still important to ask when you're seeking out for help, to understand whether that person's a therapist, whether that professional is a therapist, or the professional is a psychiatrist. So to understand the difference is important. The third aspect that I want to talk about is that of a life coach. And a life coach is someone who works with you and helps set a personalized plan for you in order for you to set and also reach your goals. And it can be both personal and professional goals that you may have. You may not necessarily have to go through anything in the sense of a mental health illness or a disorder to take the help of a life coach. But if you're struggling with, a diagnosed mental health condition, it's always best that, you let your life coach know. And in many ways, a life coach is someone who works a little bit with certain principles that are used by a therapist. So one example is cognitive behavioral therapy. That's a different topic altogether, something I may put up in another video or another audio. But a psychiatrist, in one sense, who works with you on the medication aspect of it, and a therapist, someone who works with you on the actual therapeutic process of it. It's very important that if you're going to a life coach, you let them know that you are basically working with a therapist and a psychiatrist, because a life coach cannot diagnose a mental health condition like a therapist, and a life coach cannot prescribe medication like a psychiatrist, right? So it's very important to know the differences. So just to quickly summarize, a therapist is someone you go to, and I would recommend that if you're actually struggling with a mental health issue, right? And even if you're not someone who's diagnosed with a mental health condition, I would in any case always recommend to reach out to a therapist first. Always reach out to a therapist, because they will be in the best place to let you know if you need medication, meaning if you need to see a psychiatrist. And if they feel that, okay, you're doing all right, you're going through a bit of a slump, that's okay. I see that you're going through some difficulty with the past. Maybe you've been through something difficult, you've lost someone. I don't think you need medication, but I think I can work with you to see if, we can help you heal from the past. But in terms of you wanting to achieve your goals in future, or set goals, or you want to achieve something future oriented, you can still work with a life coach, right? So I always recommend that you first reach out to a therapist. And if anyone who comes to me, I'm a life coach, if anyone comes to me and asks me, or in the course of talking, I come to understand that maybe they actually need help from a therapist, then I'd be the first person to ask them to go to one. And then from there, they can see what they need to do. It's very important that, we set the expectations right also in many ways, because a therapist is incredible at being able to help diagnose, to help you work with things. But again, I'll give you an example of something like this. So if you have a cut in your knee, right, and that's not allowing you to run, for example, suppose you're an athlete, you have a cut on your knee, right, but you have the Olympics coming up. So this is hypothetical. You have a cut on your knee, you have a big bruise on your knee, cut on your knee, for example, right? Now, it's very important that you allow that wound to heal. And that's where a therapist comes in. And this is again very metaphorical. So a therapist is someone who can deal and help with your wounds. So imagine a more emotional version of it. And there, if required, a psychiatrist also comes in. In today's day and age, I'm seeing a lot of clients and patients who are working with both a therapist and a psychiatrist. And I think that's a very good combination to have. It's a very important combination to also have, because many a times they may require medication. And the reason I'm going into this much depth is so you have an understanding of the differences. So in a nutshell, a therapist is someone who I would recommend that you go to as a first point of contact. They will help understand or diagnose and see if you actually have a mental health condition or an illness or a disorder, or you're actually you just need a little bit of support to maybe pull through what you're going through. It could be the loss of somebody, or you're feeling low, and it may not necessarily be depressive symptoms per se, or may not necessarily be equated to a mental health illness, right? And from there, they would perhaps best recommend a psychiatrist who can advise medication, and it will be specific to your condition. A psychiatrist can also be your first point of contact. That's also absolutely fine. But a lot of psychiatrists don't do what a lot of therapists do, which is actual psychotherapy, right? And that's where they are two different professions. So if you feel you're having an anxiety attack, you've never been to a mental health professional ever before, you go straight to a psychiatrist. They may give you medication to help you ease with what you're going through, but they may still send you to a therapist so you can work on the root cause of those issues. So a whole lot of what you do in therapy is root cause finding. And a whole lot of what you do with your psychiatrist is medicines to manage your symptoms and manage your illness if you have one. And a life coach, where I come in, is I work in tandem with a therapist and a psychiatrist for that particular client, and sometimes not at all also. So if there's someone who doesn't have a specific mental health illness, so suppose they're like a fresh graduate from college, or they are could be anyone, could be someone who's pursuing creative arts, for example, right? And they have a certain goal. So for example, someone comes to me and says, I'm a guitarist, but I'm having a lot of mental block, I'm not able to work on creating good music. Or there's a fresh graduate who comes to me and says, I don't know what I want to do next in life, right? So what I do is I sit with them, I understand what their requirements are in depth. I also see if they've received any, or they are receiving any mental health support from professionals. And then I basically chalk out a personalized plan. So where I come in is almost like how you have a gym trainer. This is more of like the mental health version of it. Of course, I incorporate a lot of compassion, a lot of patience, and a lot of healing practices in the courses of what I do, in the plans that I create for my clients. And I think it's important that at least that's what works for me. So I hope this distinction helps. And should you ever need someone to reach out to, I just want to say I'm here, I care, and you matter. So you will be able to reach out to me. I'll put in the details in the description for you to check out. And don't forget to subscribe to the video. Don't forget to like, comment, help me understand what your thoughts are so I can better, see what I can come up with to address your questions. And I hope you have a lovely, lovely, lovely day and week ahead and year ahead. Stay tuned for more updates. Have a great day.